became interested in dietetics when I was in high school. A family that I babysat for, the mom was a dietitian, and so that kind of piqued my interest. When I was in college, I was really interested in athletics and the nutrition aspects that went along with that. So once I started investigating a little bit more, I saw that there was really a broad range of ways that you could help people in dietetics. And I realized that sports nutrition probably wasn't the most, not the most simple way to go about starting a career, but being able to help people with diabetes, with high cholesterol, with high blood pressure and weight loss, things like that seemed to be like an area that had a lot of need. And so because I'd always been interested in nutrition and how it helped your body work better and perform better, it just kind of was a fairly easy transition to wanting to be able to help people who weren't necessarily athletes, but just trying to improve their lifestyle and improve their health. My role with Innovative Weight Loss Solutions is fairly simple. I handle all of the nutrition aspects of our program, so I'm really the one person who's probably following the client for the longest period of time. I do education with them before surgery, I do education with them while they're in the hospital, and then I continue to work with them after surgery for a minimum of 6 to 12 weeks, and as long as they're willing to let me keep working with them. I have some people who come in to see me still 6, 7, 8 years after surgery if they're having questions or problems. So I really take them through the whole process. Other ways that I personally assist people, I do a lot of phone conversations, I do a lot of email because it's not always convenient for people to come in and talk to me. As simple as just a question about a particular food, or maybe someone's going on vacation. I've had someone call and say, we're getting ready to go on a cruise and I'm not sure how I'm supposed to manage with my lap band or with my sleeve, depending on which surgery they had. I've had people call me from the grocery store and say, is this the right type of supplement that I'm supposed to use? Other things that I do for our program, I help run our support group, which meets once a month. That's a huge part of our program, and I really enjoy presenting nutrition information at support group, but also just kind of facilitating the discussion with the people that come and let them kind of support each other, which is the goal of our support group. What I probably enjoy most about working with weight loss surgery patients with Innovative Weight Loss Solutions is that I get to work with them over a long period of time. When I was a clinical dietitian here at Geary Community Hospital, usually I would just see people once, maybe twice. People don't tend to always, keep coming back to see the dietitian for whatever reason. But with weight loss surgery, I really get to know people a lot better because I get to see them over a long period of time, and I get to see them through that whole process from before surgery to after surgery. And I really enjoy that. I really like being able to work with the same people over the course of a few months or like I said, some of them even for several years. The Back on Track program started through Innovative Weight Loss when insurance companies really cut back on their coverage of surgery. A lot of insurance companies will not cover weight loss surgery, and a lot of people don't qualify for many different reasons, health reasons, or for reasons of you have to have a certain weight before you can qualify for surgery. So we really wanted to offer something for people who, or maybe even someone who didn't want to have surgery for weight loss. So the Getting Back on Track program is there to really just help provide education and support and accountability through a longer term program, anywhere from 10 weeks to 3 or 4 months, where I just provide that support and that education to those who aren't able or aren't interested in having weight loss surgery, but still have a significant amount of weight to lose. My patients should know that I'm not a typical dietitian. I like to say that. I think it's true. I tend to bend the rules a little bit or a lot. I like to really cater everything I do to the individual that I'm working with. So certainly there's a gold standard as far as nutrition care, depending on what your situation is. But my first question to everybody is always, what are you willing to do? What are your goals? What do you want to accomplish out of this? And I'm going to do my very best to work with someone on that. So if you come and tell me I'm going to eat out every night of the week and that's not going to change and that's just my lifestyle, my goal is really to work with that and to help you find the best way to accomplish that. So within the constraints of what each individual person has going on. So I'm never someone who's going to give a lot of, you can never do this, you can never do that, you have to quit this, you have to quit that. And I think that makes me a little bit unique in the dietitian world. But I think it helps people be more willing to come back and want to come back and visit me more than one time. The best advice that I could give any patient who comes to see me, and this would be if someone was coming to see me for getting back on track or because they were having weight loss surgery or because they were wanting to just lower their cholesterol or improve their blood sugar levels, my best advice is that small changes over time are going to always yield the best results. Rather than trying to make huge, tremendous changes and lose a bunch of weight all in a month, that small things are the things that are going to get you there. So, and my other piece of advice is always to expect setbacks. It's often going to be 2 steps forward, 1 step back. Sometimes it might even be 1 step forward, 2 steps back for a while. But so being prepared for those setbacks, I think, is a really important part of the process. But anyone can do it. I mean, anyone has the ability to be healthier today than they were yesterday. I mean, everyone can do it. And it's certainly not all about the scale.